All right, thanks for staying with us on TVC Breakfast. We are going into our main discussion. We're still talking about International Special Days. The World Health Organization estimates that the incidence of Down syndrome is about 1 in every 1,000 live births globally.
Now, Down syndrome is one of the most common chromosome abnormalities in humans. Affected Nigerian parents are calling for understanding and support. Let's play you this report by Vivian Irikefe.
Oh yeah, let's do this! Go!
This is a charity football match to raise funds and support intervention programs for individuals with Down syndrome in Nigeria. Down syndrome is a genetic disorder with different levels of physical growth delays and intellectual disability, which could be moderate or severe. An affected parent says superstitious belief and stigmatization against people with the condition is depriving a lot of people with the condition who needed help.
A lot of people think that these children are born as a result of some witchcraft or superstitious reason, but that's not the case. The thing is, we are trying to create the awareness of that the condition is just a natural condition.
There is no cure for Down syndrome, but with early specialized education and proper care, they can excel in their unique individual talents.
Down syndrome Foundation in Nigeria, the people in the school drumming, singing, running, sports, basketball, and running.
I work here for Down syndrome, and the children to go and learn everything to play ball.
Caring for a child with Down syndrome is a lifetime commitment, and parents and caregivers need all the support they can receive.
All right, it's good to see the support system going out there for people who have Down syndrome.
Of course, we'll try to find out exactly what this Down syndrome is, because every year that we talk about it, there's a tendency to actually think that because of the physical, expressions of Down syndrome, that we actually do understand what Down syndrome is. But maybe our guests will be able to help us along those lines. So we're joined now by Registrar Medical Rehabilitation Therapist Board of Nigeria, Olufunke Akonle. And also joining us is Tola Makinde, founder and creative counselor, More Rainbow Down Syndrome Ability Center. Good morning, ladies, and thanks for joining us. One thing that really fascinates me every time I watch, this individuals, young people, older ones with Down syndrome, there seems to be this excitement and this, really happy disposition about them. What is it about Down syndrome that makes people so happy all the time? First off, let's even define what Down syndrome is. What exactly is it?
Thank you, viewers in the house, and happy World Down Syndrome Day. It's nice to identify with this set of individuals.
Yes.
It shows that we're giving them a good recognition, and because they're also part of the populace, and they have to be given the recognition. Now, Down syndrome can be defined as a chromosomal disorder that's when there's a division, there's an error that causes division of the 21st chromosome. Of course, it's like I said, it starts at embryo, the development, when the child at the developmental stage, and it can be detected early. Maybe during the pregnancy, you have to do some screening tests to discover it. So that's basically the cause of Down syndrome. And of course, it has been associated with being pregnant at old age, maybe above 35 years. A woman, a pregnant woman above 35 years, you have to screen against Down syndrome. So that's basically the cause of Down syndrome. And there are some symptoms that they present. Start from their face. They have flat face. The nasal bridge, they have flat nasal bridge. That's where you have the nose being flat. And Another presentation is that they have short stature. They are short in their stature, and they have low muscle tone. They are very flabby. There are two major disorders that we have there: cognitive disorder and the physical disorder. And talking about the physical disorder, it means that their development is not like normal children. Developmental milestone is being delayed. Some of them get to walk, even sit at like 12 months. They get to stand and started walking probably about around 17 months. And even takes longer than that. Some even at 3 years, they are still not walking. Depends on the intervention they're able to enjoy, particularly at that early stage. So Down syndrome is a condition that in rehabilitation, it engages almost all the rehabilitation professionals. Talking about physiotherapy to take care of the gross motor skill, because they have delayed gross motor skill. When you talk about gross motor skill, probably ability to sit, to stand, and all that. So at every stages of their development, you have to follow them up to develop their motor skill. Then they also have a delayed fine motor skill, and in that case, we have to come in, like some of them, they have speech defects. They cannot speak, they don't speak at the right time. So a speech therapist will have to come in to take care of that. So an occupational therapist is there to take them to every stages. How to brush their teeth, how to, you know, take care of day-to-day activities, daily living. So it engages every aspect of medical rehabilitation. Let me just quickly talk about medical rehabilitation. Medical Rehabilitation Therapists Board of Nigeria is a regulatory body established by Decree 38 of 1988 to control and to regulate the training and the practice of 7 professions in Nigeria. And these professions are physiotherapy, occupational therapy, speech therapy, audiology, orthotics and prosthetics, chiropractic and osteopathic medicine.
Wow, I wonder how many of these professionals are really available.
Yes, that's where the
another issue. We'll come to that.
Exactly.
Definitely.
Okay, let me go to my wall now before I ask Tola Makinde any questions out here, because I know that when it comes to care, I'd like to take you on that because you are one of the parents of those who have that. But let's understand this basically. Now, today, March the 21st, marks the 12th anniversary of the World Down Syndrome Day, and we are talking about this to commemorate and create more awareness about this. Now, this year, social activists are calling for global action to enable people with Down syndrome to be fully integrated into the society. That's one basic thing we'll be drawing attention to today too, to have them speak up and be heard. Down syndrome occurs in people of all races and economic levels. And let's break it down here to your understanding. Now, human cells normally contain 23 pairs of chromosome, and usually if a parent, that's the mom and dad, are to give birth to a child, now both of them have to release 23, that's the pair of this, to make it 46 for the child that is coming up. So usually a person should have 46 chromosomes each, but one chromosome in each pair comes with the mother and the father. That's what I was talking about earlier. Now, the problem sometimes, now Down syndrome results when abnormal cell division involving chromosome 21, usually here. That's where the issue usually is. Now, individuals with Down syndrome have 47 chromosomes instead of the usual 46 that everyone has. So it is this extra genetic material, you know, that causes the physical features and developmental delays associated with Down syndrome that we were talking about earlier on. Now, the estimated incidence of Down syndrome is between 1 in 1,000 live births worldwide, and each year approximately 3,000 to 5,000 children are born with this chromosome disorder around the world, and that's according to the World Health Organization. Now, Tola, let me ask you, when it comes to when you discovered that your child had Down syndrome, what was your first reaction? How did you take it? How did you handle it?
Oh well, first of all, I was in shock. Then, but I had been exposed to a child living with Down syndrome before, 7 years before I had my daughter.
Okay.
Somewhere in the US, and I'd stayed with them before. So I understood the condition. Immediately the doctors told me my daughter had Down syndrome, and she was like about 7 days old then. So first of all, I was in shock, and I just couldn't believe, you know, that was happening to me. But because I remember that there was something I learned then when I met my friend's son in the US. I saw therapists come in, back-to-back interventions, and for him, I just knew there was something I needed to do on time. So I picked up my phone, called my friend, and she told me, look, it's okay to cry, but you have to wipe your tears and you have to do what you have to do and start right now. And that was how I tapped into early intervention. For me, I forgot about my banking career. I'd worked in the bank for 11 years before then. So I just told myself I'm going to face this monster. And at 2 weeks old, I stopped living in denial. It took a lot out of me, but I had to tell myself, okay, yes, Mom told my family members, she's got Down syndrome and I have to deal with this. And they all kept saying, oh, she doesn't have it. In Jesus' name, I'm like, you guys, she has what we call Down syndrome, but she's gonna be fine. And you know, my sister being a medical doctor in the US told me that I just need to start early intervention. So as little as she was then, at 2 weeks old, like I said, I tried to bring myself out of the denial stage. And sometimes as I'm breastfeeding, I'm doing the therapies, abduction exercises, so many facial, oral, motor exercises, massages. I began that at 2 weeks old. I began to talk to her. You know, there's a lot you need to engage that child with because development might be slower. Not even might be slower. They are milestone developmental delays. So you have to just face it. And if you don't miss it then, the child's outcome will be
a lot better.
Yeah, because
okay.
Therapy does a lot.
You know what, Tola? I really want to hear more about how you've been able to handle this as a caregiver, especially as a parent. But let's quickly take a break, and when we come back, we'll be talking more about this Down syndrome. All right, you're welcome back. You're watching TVC Breakfast, and a very exciting morning we have here talking about Down syndrome. I'm hoping that by the time we're done with this discussion, people will be more enlightened, and whatever shame and stigmatization that actually surrounds this particular condition would no longer be there. And
you were even earlier, you were talking about that happy disposition towards these people. So it wouldn't just be the parent of anyone who has Down syndrome. It wouldn't just be the caregiver. It would be everybody. In schools, in churches, anywhere in the public place you see them. That happy disposition is, I think it helps to, make them feel, good society.
They have a sense of belonging. Okay, our guest right here is Lufunke Akonle. She's Registrar, Medical Rehabilitation Center. They, of course, deal with people or individuals with Down syndrome. And Tola Makinde is a caregiver herself. She has a daughter that is living with Down syndrome. But of course, before we went on that break, you were trying to tell us, educate us on how it has been so far with you. How old is your daughter now?
She's 6 years old.
She's 6 years now.
She'll be 6 next month.
Obviously, you discovered this condition when you were in the States, like you said. Oh, here?
Nigeria.
In Nigeria?
Yes.
Oh, okay. I got the impression that, it was,
I had been exposed to a child in the States.
Over there in the States. Okay.
7 years before I had my daughter.
Okay. So now, earlier, Olufunke was talking about the number of experts that are available to take care of, I guess, not just Down syndrome individuals, but generally. I wonder how has it been in, actually getting the services of some of these experts, like the physiotherapist, maybe the specialized educator and all of that. How easy has it been or otherwise?
Yeah, when she was about 1, because I'm the first advocate, so I was involved in a lot of therapies. I'm not a therapist, but I had to learn so many things just to make sure that I'm giving her the best to, for optimal outcome. So at the end of the day, I got tired and, of course, depressed, and I was so tired. I needed help. So I started going around looking for help, and I realized that there wasn't much help around. And you go to some outfits and they'd be like, okay, we'll let you know. And I wanted feedback. I was more interested in, okay, what are you doing with my child so I can continue at home? Because I know that back-to-back therapy intervention helps a lot. And I found it difficult. People were holding information. So I got tired, and I knew that I had to like help my daughter, so I had to go back to the US to get help, and then I got exposed. Maybe probably I just relocated to Lagos, so I wasn't really used to where to get help. Maybe, let me put it that way. So I'm talking about the kind of help I found around. It wasn't up to my expectations, so I went back to the US and I was able to get help. I was exposed to all forms of therapy a child with Down syndrome would be needing. I met with occupational therapists, speech therapists, and physical therapists, and they showed me, they enlightened me more on what to do. So by the time I got back to Nigeria, I was already knowledgeable, and I knew what to do, even with a newborn baby, because I started with my daughter when she was 2 weeks old. I just accepted, and I started all the therapy, all the swaddling, everything I needed to do, the lip, oral massages, even as a baby, because from the time they're 1 year old, they already are aware, they begin to protest. You can't do so much. And all of that helps to form their ability to be able to do, what do you call, their milestone, which of course is naturally delayed. So I think it was when I got back that I started reaching out, looking out for therapists. It was still a bit difficult because some therapists call themselves therapists and they really don't know what they're doing. And sometimes I find myself buying materials when I travel, and I'm showing a therapist, and she'll be like,
they don't have an idea what
do you, oh, this is nice, oh, this, and I tell them, okay, can you go back and read about this? I just know she's going to be needing this, blah, 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 like that, and I just drop it. So I started to challenge the therapist, and I realized some of them don't even use equipment. Some of them just say they can do this job, and really, I don't know what's going on. I don't know if they have certificates, I don't know much, but I just knew that I had to do something about that condition. It's bad enough if you know this condition and you live in denial, so I had to step out. And when I realized that so many people, so many children were not having any intervention, any form of intervention, then I had to God pushed me out. Let me just put it that way. Then I started talking about the condition that you can, once you detect it early enough, like you said, from birth, there's so much you need to do with this child. You don't need to wait till the child is 4 years old or even 2 years old. Or it might be late,
and
because
you want to start hiding them.
Yes, they have a mind of their own. You can't even get much. But there's still hope.
Okay. Now, Funke, when it comes to the level of awareness around our society, even here in Lagos, that is seen to be the pinnacle of, if I have to make comparison between Lagos and other parts of the country, people have more exposure here and enlightenment. How much of it do we have as a people where we are right now?
Thank you very much. The level of awareness is actually very poor, particularly with the services that the physiotherapists, occupational therapists, speech therapists can offer. And one of the cause of this is because the numbers of these professionals that we have on ground, they are relatively few. Physiotherapists, we still have a good number of physiotherapists compared to all the other professions I mentioned. As I speak with you now, we have just only 9 institutions in Nigeria where physiotherapists are being trained. And we have only 2 for occupational therapists, 2 for speech therapists and audiology. You can imagine a teaching hospital for well over 850-bedded hospital having just only 2 speech therapists, 10 or 5 physiotherapists, and like 1 occupational therapist. How will you be able to cope with the number of patients that will be coming to such a center? So that is one of the challenges that we're having in the country. The number 2 is that the communication between the doctor who ought to have diagnosed this patient at that early stage after birth, a pediatrician that should have been able to look at the child and say, oh, this baby has Down syndrome. Please, can you go to physiotherapist to receive the treatment or to start the rehabilitation? They don't, number 1, realize that, oh, we need to refer this patient on time. There are times that it is even the parents that puts pressure on the doctor.
Yes.
Doctor, what else can I do for this child?
Yes.
Is it only about taking drugs?
Yes.
Is there another thing they can do? And like we know now, the whole world has become a global village. So many parents go to the net to search for information. And when they get, oh, I need physiotherapists, I need occupational therapists, I need speech therapists, then they start hunting for these professionals. But unfortunately, they are not readily available because most of our government hospitals that should have these services available, they don't have them. They don't give their priority, even in their recruitment. If an hospital is recruiting like 100 doctors, they may only request for 2 physiotherapists. Wow. And at the end of the day, they may only employ one physiotherapist. So from the, we have problem from
obviously there is a need for serious, deliberate policy to actually, you know, serve as some kind of incentive for people.
Thank you very much.
When you ask somebody who wants to read medicine, for example, they just say, I want to be a medical doctor. That's it.
That's it.
So maybe there's a need for...
Yes, let me just quickly bring that in, because since I became the registrar about 2 years ago, have been so much passionate about to create more awareness about the need for rehabilitation for persons living with disabilities in Nigeria. And we have come up with a policy, we have developed a policy on access to health by persons living with disabilities in Nigeria. And the reason for this is that, talking about rehabilitation, we have 3 levels that we must have rehabilitation. Community-based rehabilitation, at the grassroots level, at the community. Because even when this patient has been discovered and there's a need for the rehabilitation, then you have to get to their community. You can't keep them in the hospital environment forever. Rehabilitation takes a longer time. Like we have said, Down syndrome is a lifelong management, because at every phase of their development, you are intervening. You are bridging the gap between the chronological age and their mental age. You are building and bridging that gap. So in doing that, it's not what you can do in the 4 walls of the hospital. You have to bring them to a rehabilitation home. And
to the real world.
And as I speak to you now, we don't have a standard rehabilitation center in Nigeria. Not even a very good one that you can point out, particularly from the government establishment. So we have been advocating, we have been putting some modalities in place to come up with a national rehabilitation center. Just like you have a national orthopedic hospital, you have a federal neuropsychiatric hospital. There is an urgent need for an establishment of national medical rehabilitation centers where the services of these professionals will be readily available. That's number 1. The number 2 is that we need to improve our training, provision for training. Like I was discussing with a group of individuals a few days ago, and I told them that most of our wards that are seeking admission to universities, the only thing they know is that I want to be a medical doctor. If they are not getting admission to read medicine, they want to do pharmacy or nursing. Outside those 3, they don't believe there's any other profession.
All right. In all of this, I would certainly like to ask you after the break how private participation should be encouraged into this, because it seems the government cannot do everything. Well, we'll come back to all this. Stay with us on TVC Breakfast. We're talking about Down syndrome today, because today is the International Day for Down syndrome, or World Down Syndrome Day. Let's go on a break. We'll be back. Don't forget, top of the hour, but time for us to go for the news update. Stay with us. All right, thanks for staying with us on TVC Breakfast. In a few minutes, we'll be going for the news update. But we still have with us in the house Olufunke Akonle and Tola Makinde. We've been talking about this. Now, Tola, let me stay with you here. Tell us basically what led to your, apart from being a parent of someone who has Down syndrome, what circumstance led to you taking it another step of opening a center, you know, to care for people like that?
Okay, I came across a boy with Down syndrome, and from afar I looked at the boy and I noticed that this boy's got Down syndrome. It was floppy all over. And immediately I just told myself, this boy has never had any form of intervention. So I walked up to the mother and I said, hello, can I meet you? Can I meet your son? Of course, she wasn't too happy or smiley because the boy was all over the place. Eyes, you know, he has nystagmus, and my daughter had that one out. So
nystagmus?
Yes.
Okay, you'll define what that is for us.
It's the pupil, the black pupil, the way it just vibrates and rotates all over. So it's not near. And that affects hand and eye coordination, and it's common in children with Down syndrome. And so I told her, okay, meet my daughter. And then my daughter, because she's been exposed to therapy very early, and at 1 year plus, if you say handshake, she could bring out a hand, you know. So we exchanged phone numbers, and I started to visit her, call her, check on her. But that day I got home and I had this thing in me saying, you see, you're not alone. You have to be out there. People don't know what early intervention means. And I just found myself weeping that day, that night. I was alone in the room, but I was hearing it and it was clear. You need to go out there, and that was how I started advocating for people living with Down syndrome, especially in the area of early intervention. You know, and one beautiful thing about therapy is that it improves the compensatory movement patterns. Yeah, continuous therapy. And children living with Down syndrome will teach you a lot of patience. They are coming from a happy disposition. You've been talking about them being happy. That is just how they are. They are coming from a happy disposition, and if you compare it to every other form of disability, they are always like happy. I'm not seeing a moment that might be unhappy, and apart from that, they are able to express. It depends on the kind of love you give to them. So I realized that there is a lot of work to be done. People don't know these things, and they lock their children up at home.
I'm tempted to say there is no depression with the Down syndrome person. Just permit me to say that, okay? So
World Down Syndrome Day, that's what we're talking about today, and creating awareness and commemorating this and letting people know what can be done, especially in our society here where a lot of people don't seem to have much knowledge from what Funke has told us before. Enlightenment is very key to knowing and how to understand and help in cases. Now, let's take this report now. There's a common belief that people with the Down syndrome condition cannot do many things that others can, but specialists believe otherwise.
now, this is the reason behind the Down Syndrome Awareness Week. This year, participants want everyone with Down syndrome to get active and get involved. Wendy Agbo reports.
Omeri has Down syndrome, but he learns and loves to sing. Children with Down syndrome can go to school and learn some vocational skills. This is a level 4 class of people aged between 12 to 34 years. An art demonstrative class is currently ongoing.
Okay, so you can use this to start your work. Just wait, wait out. I'm going to tell you when to start now.
We have different kinds of vocational training which they do. We have catering, we have photography, we have tailoring, we have hair making. So we allow these children, if they come in new, go through all this vocational for a year, then anyone in which they pick interest in, that's the one we allow them to do.
Children with Down syndrome are often discriminated against, even by their parents, who are often too ashamed to be associated with the children. Steve Gatlin, father of a child with a condition, believes the first step for a parent is acceptance.
When I found out that my son had Down syndrome, I was terrified. I had to go and start looking on the internet, talking to doctors, talking to specialists, but the one thing that I didn't have to overcome personally was the challenge of whether I was going to accept him as my son or not.
I mean, we have the center here, we have the foundation, but many people are running away, not coming, because they don't want them to, they don't want others to know that they are children like that. But if the awareness is there, that there's nothing wrong with these children, if we help them, they will be independent, they won't be a burden, and they can, do anything they want to do in the future. So it will be easier for, for the parents to come forward.
It is a fact that Down syndrome is a lifelong condition. But with the right kind of care and support, children who have Down syndrome can grow up to live a healthy, happy, productive lives. Wendy Agbo, TVC News, Lagos.
Yes, indeed. They may be different from us, but they're not necessarily inferior. And the whole perception that they have these lower adaptive skills may not necessarily be true. Like you heard there, they can learn all kinds of skills.
Other skills. Yes, they can. That's the purpose of developing their gross muscle skills. Because when you develop that, then ability to use every part of their body to carry out one activities or the other. And when you improve on their cognitive skills too, it helps them to be able to put one or two things together and move on in life. And one thing you have to discover is their own areas of strength, what they really want to do, because you have to build them around what they are interested in.
Isn't that what we really should be doing with normal in quotes, normal human beings?
Yes.
I mean, parents bring the kids into the world and you study them, you know what their strengths and their weaknesses are, and all of that. How do we now come to a place where we just take it really as normal?
Normal, every day. Yeah. Come on, you know.
Yeah, I think the awareness needs to be stronger out there. And I'm happy that I'm able to gather parents with children, little children, 1 year old, 10 months old, you know, that's early intervention. That is very key, because from there you can begin all forms of therapy. Yeah. You know, sometimes I look at the physical features as that's just like, it's what makes parents want to hide their child because of the mid-facial bones that are underdeveloped and all of the other features she had mentioned earlier on. But I mean, that is not enough. Something great, something good can come out of that child. So by way of all the therapies she has mentioned, it is going to help that child a long way to, you know, become whatever the child wants to become, you know. So we are involved in all forms of therapy, physical, occupational, for fine motor skill development, which is very, very important for them. Occupational therapy for them to be able to have life skills, independent living and all of that. So that is all what we expose them to as little as 1 year old from when they begin to walk. And some of them also need braces. Thank you. Yeah. Because my daughter had to be on that for 6 months. Autistic, yes. Okay. So a lot is involved in helping a child with Down syndrome have a good life, and he has to start from when the child is a baby. Okay.
All right, Funke, I was asking earlier on before we went on break. You talked about the inadequate centers, inadequate personnel to handle all this therapy, as the case may be. What is being done to ensure that private participation, because government cannot go into all of this all alone?
Thank you very much. In respect of that, we are actually trying to develop PPP in rehabilitation services. We'll talk about PPP, public-private partnership. We have investors that will not mind to invest because rehabilitation really is expensive. And that's why so many health facilities try to push it aside, looking at the financial commitment and the
what they should get out of it.
They are expected from such individuals or patients. For example, if a patient is having malaria, typhoid, or one condition that just one intervention will bring results, they are more interested in that. But when you're talking about patients with Down syndrome or patients with any form of disability, rehabilitation takes a longer time. And the facilities you need to put together for rehabilitation is, of course, is financially intensive. You need to put a lot of money into it. So we are trying to put up a situation whereby we develop PPP in rehabilitation services. And one-stop rehabilitation center is still the key, because going to look for a physiotherapist, you get there, you pay that amount of money, you go around looking for a speech therapist, from there you move to an occupational therapist. It's more expensive, it's more stressful, it's more demanding and all that. But when we have a one-stop rehabilitation center, all these facilities, human resources, everything are in place, and they're able to pay minimally to get adequate services. And just to buttress the Minister of Health vision to revitalize primary health care, to meet up with universal health coverage, I always say that there is universal health coverage cannot be complete without rehabilitation services. And with that, we're also looking at our primary health centers having these community-based rehabilitation centers, whereby at the grassroots level they can meet within this. But let me just quickly say, I really appreciate our mother here who has really been taking care of this baby at that level. But I want to emphasize that all the services of rehabilitation professionals are highly important. Why? Because the dimension with which a parent, as a mother, will put into the service, into the management of these children is quite different from the professionals. The skills are there. You know, the passion you have for the child, there are some things that you want to do that a physiotherapist will handle the child, manipulate some joints, do all that you as a parent, you want to be
very emotional.
So we always want Throw it back to them. Let them do the work. And I appreciate the NGOs. Last year we had an interactive meeting with the NGOs on disabilities. It was a very interesting meeting. And what we're trying to do is that let's connect everyone together so that we can focus and move on with one goal. They have their role to play, and the professionals also have their role to play. And we, the arm of government and regulatory body, we have the major role to play.
Now, I'd like the both of you to respond very quickly to this particular. We have to go on break. Let's take that break very quickly, and of course, we'll come back to this. All right, you're welcome back. We're talking about Down syndrome. We hear that 1 in 1,000 globally actually suffers, Down syndrome, but there are no clear statistics about the number here in Nigeria, and people of different races actually do suffer this Down syndrome. Our guests right here, before we round off Lufunke and Tola, I want the two of you to respond to this particular one. The moral question of whether to abort a Down syndrome baby, of course that's already still in the womb, especially when a parent discovers that there may be problems, and the problem really is Down syndrome. I want you to address that as a parent for a young woman or couple out there who may experience this. The baby's still in the womb. Some expert actually some time back actually said, look, it's better to abort than to bring those kids into the world and allow them to suffer. What do you feel about that? And of course, you, Lufunke, Tola.
Well, I will say that I really don't support, but it depends on, like some people are actually afraid that if I have this child with Down syndrome and I abort this child, that means I might have another child with Down syndrome.
So what will I do
in the first place, why do you want to abort the first one? Because I've seen people have the first issue with Down syndrome, and all other children are normal. And now, Down syndrome predisposes them to a lot of stuff. We know that, and it's a lot of heartache and everything. But I think with all the form of therapy in place, I think the child can have a chance.
Normal life.
Yeah, to have a normal life.
Lufunke.
Well, I am not in support that one should terminate any pregnancy because you observe that the child has a Down syndrome. We have a lot of congenital deformities at every stages of child's development, and even some of us as adults. For example, if a patient sustains stroke and you're managing this patient and you discover that there's a paralysis of one side of the body, do you terminate the patient's life and say it's better for the man to die than to continue to live? So if there's an occurrence that, this may likely come up to be a Down syndrome, I still want to encourage that we have to give it. It is God. God knows he has everything, and he knows how to handle everything. And you see, challenges in life differs. Look at her here today. She is meeting some people's needs, particularly the areas of Down syndrome. There are some that even when you want to terminate, it may not be possible to terminate because God has a plan and a purpose for that child.
And I can tell you for free,
it's better to allow this child to live.
Yes, and looking at this booklet here, I wish our camera could actually. Sorry, I want to draw attention to this. Looking at your daughter, Munyolua, this picture speaks louder than a million words as to. Look, go ahead and have this baby. It is worth it. This child is really so beautiful. I mean, you can see.
No, he's really cute. He's really cute.
She's so cute. Let's just say thank you so much.
Well, we have to end it here right now. Thank you very much for coming, Olufunke Akonle and Tola Makinde. Thank you very much, and we wish you well and happy World Down Syndrome Day. If we have to, it's a happy disposition, so let's keep it up that way.
And we need to get happy too.
Yeah. Nigerians were happiest people on earth.
About disabilities, so please give us more protection.
No problem. As time goes on, we'll certainly have create that avenue. Thank you.